All right, thanks, Brett. All right, well, afternoon, everyone. Thanks for taking time to hop on our update call. Like normal, we'll go ahead and start with a review of the data. And so, Jordan, if you're ready, go ahead.
All right, let me share my screen here. Thank you all back here. Okay. All right, so we're looking at the MySafe Start data here, and we're starting to see some of our counties move out of the E risk level, with Kalkaska, Lake, and Mason in the D level, and Manistee in the C level. The daily case per million overall for our jurisdiction is at 152.5, and 150 is the threshold for being at an E level. So even though we don't, consider or have a risk level for our whole jurisdiction, we would be in the E risk level, and that's where we have been. So hopefully we can soon drop below that. And our percent positivity is under 10% with a 7-day average rate of 8.8%. We have seen a 42% decrease in cases when we compare this week to the previous week. And the cases that we've seen in the past week have come from household and community contact, school, sports testing, daycare, pre-surgical and inpatient testing, religious services, care facility, social gatherings, recent travel, and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday was 19,350, and cases by county as of yesterday are Crawford with 912, Kalkaska 1,030, Lake 574, Manistee 1,093, Mason 1,981, Mecosta 2,970, with Ferris reporting 738 cases, Masaki 1,243, Newaygo 4,438, Oceana 2,589, and Wexford 2,520. In the past week, we had 8 deaths reported to us and 1,291 people who recovered. Yesterday, there were 2 positive inpatient cases at Munson Healthcare Cadillac, 4 at Munson Grayling, 1 at Munson Manistee, 9 at Spectrum Health Big Rapids, 5 at Spectrum Health Gerber Memorial, and 2 at Spectrum Health Ludington. And now I'll switch to our vaccine table here. The state of Michigan is at 56.8% vaccinated as of yesterday, and the next step for the MyVac to Normal plan is 60%. And then this front table here changed a little bit. I did take out the 65 and up population from this gray part because we are providing you with age groups by county in these 2 tabs here. So that changed. And then they added in this new column, and this data comes from My Lighthouse dashboard created by U of M for MDHHS, and that is like a private dashboard that just some LHD staff have access to, but this shows the percent eligible population in each county that have initiated their vaccine series. And earlier on the call, I said it was 12 and up, but it is 16 and up for the eligible population that they are using here. And I think that MDHHS will also continue moving forward with considering the eligible population as 16 and up, because when they started the MyVac to Normal plan, that's what it was. So even though 12 and up are eligible, when we're looking at percentages, it will still be 16 and up. And then another data point that we added to this table is breakthrough cases. So just wanted to share with you an idea of how many breakthrough cases we're seeing, which is after someone has completed their vaccination series that they're then that they then have a positive test. So the definition is down here. So as of 5/4, so we get provided data on breakthrough cases on a weekly basis, but it's sort of older data once we finally get it. So as of 5/4, 0.18% of those who completed their vaccination series in our jurisdiction were breakthrough cases. So that's just a small percentage to be expected. And this number is likely an underrepresentation just because of how those breakthrough cases are reported and, the number of tests that are happening right now and so on. So just another piece of information that we will be sharing with you. And then, as always, these tabs have initiation, vaccination initiation. That is a tongue twister. By county and age group. So new age group added in there of 12 to 15 years. So on the completed tab, you will see that they're all 0%, and that's because in order to be considered complete, you have to be 14 days past your second vaccine, and it takes 21 days to get that second vaccine of Pfizer. So we haven't been giving vaccines to 12-year-olds, 12 and up, for 35 days yet. So that's why these are all 0% right now, but you can see how many have initiated their vaccine in each county there. Are there any questions?
All right, looks like none. Thanks, Jordan. All right. Well, as Jordan's data shows, we are starting, we are continuing to see some good trends. Cases our positivity rates and cases are both going down. Yesterday we had a little bit of an uptick, but hoping that is just a blip in there. So we will continue to watch that. We are continuing with our vaccination efforts. We are doing first dose clinics on Tuesdays and then second dose clinics on Friday, although individuals are pretty much able to come in on either Tuesday or Friday if you need a first or second dose. We are still taking appointments, but we're also taking walk-ins. And so we have been seeing a fair number of walk-ins in all of our counties. We also have are making available any of the 3 vaccine varieties. So whatever someone wants, if it's Johnson & Johnson, if it's Moderna, if it's Pfizer, we have that available at all of our clinics. And so, what it is, whatever variety you'd like, that's what you can get vaccinated with. In addition to those in-office clinics that we continue to offer, we are also working and are doing out-county, more pop-up type vaccination clinics. The days of us doing those 300-400 dose clinics are gone. We know that the highly motivated people have already been here and they've been vaccinated. And so now we need to find those harder to reach, those individuals that most likely would get vaccinated if it's convenient for them. And so we're kind of taking the show on the road and going to where they are to hopefully vaccinate them. As an example, last Saturday, we did do a pop-up clinic at the Newaygo County hazardous waste drop-off type site, and we did vaccinate 10 individuals there. We also had a tent set up at Blessing of the Bikes in Baldwin that afternoon, and we did vaccinate a total of 13 individuals there. This week, yesterday, actually, we had a clinic at the Double J Ranch. This was a second dose clinic, so a follow-up clinic to one we had done earlier, but we did see a fair number of individuals also walk in. Did 109 individuals there. Today we have a clinic from 2:30 to 6:30 at the Iron Fish Distillery in Thompsonville. And then yesterday we also did another vaccination clinic in Manistee with Manistee Public Schools. I believe Manistee Catholic Central was also invited into that, and we vaccinated 30 individuals. So right now, individuals 12 and up are able to be vaccinated. Although 12 to 17, you do need to use Pfizer vaccine. That's the only vaccine that's approved for that age group. And so, making sure that we take that with us when we're out doing those. So next week, we do have some other clinics some pop-up clinics that'll be taking place. On Wednesday, we'll have one at the Little River Casino. This will be a follow-up to the one that we partnered with them on earlier. And then we also have one on another one on the 26th. This is going to be in Fremont at True North food distribution site. We'll be doing vaccination clinics there. And so we do continue to explore alternative sites. So if you guys have ideas or know of festivals or other opportunities to, for us to either set up one of our tents or to use our mobile unit, let us know, and we will, we can come out there. These pop-up vaccination clinics, we know we're not going to see large number of folks, probably 10, 20, maybe 25 or 30 folks. But again, those are, those numbers represent people that are most likely not coming into our office to be vaccinated. They're probably not going to go into the FQHCs or the pharmacies or their doctors to be vaccinated either. So if we can get to them, hopefully we can convince them to get vaccinated. So those are kind of the next steps in this vaccination process that we are going to be going through. And I would imagine at some point here, maybe by July, our vaccination efforts will just kind of get morphed into our regular immunization type offerings that we have. So we would just, we would be offering COVID vaccine just like we would any other type of vaccine that we have and have it available on vaccination clinic days. So within the health department, we have, and actually we've been doing this for about the past month, but we have unlocked our front doors and allowing individuals to come in, to make appointments or come, have appointments prior to coming in. So working to try to get back to offering all of our services that we normally have. Our goal is hopefully by July 1, we're back to operating as close to where we were pre-pandemic as we can. Knock on wood. Hopefully everything continues in the direction that it's going. So that is our plan right now. Everyone is probably aware that last week, Thursday, I believe, the CDC issued some new guidance. And that guidance kind of differentiated more so or additional things for individuals that are fully vaccinated versus those that are not vaccinated. And now individuals who are fully vaccinated did not have to wear masks at outdoor or indoor type gatherings. And so just again, more freedom being afforded to that vaccinated population. On Friday then, late Friday, MDHHS did update their epidemic order to reflect the new masking guidance. The one difference between the two in the CDC guidance, the not having to wear masks in outdoor or indoor type events did not include healthcare settings, schools, jails, or correctional type facilities or homeless shelters, where it is still recommended that individuals mask up in those type of situations. The MDHHS orders did not address that. I am envisioning that MIOSHA is also in the process of updating their orders, that they will focus more on individual work sites like they have with their previous orders. And we are hearing, or I should say, I'm hearing that my updated MIOSHA guidance may be out on Monday. So we're kind of waiting to see what's going to happen with that. But for, with the health department, right now our plan is we're going to continue as is and require masks in our building of both employees and of the public coming in. You're probably also aware that this morning there was a press gathering with the governor, and also, and as part of that, she had indicated that as of June 1, all capacity limits will be lifted for outdoor events. And then additionally, indoor capacity limits will increase to 50%. And that'll allow for some indoor social gatherings such as weddings and funerals to move closer to normalcy. And then as of July 1, the state will no longer limit capacity at indoor or outdoor gatherings. It's my understanding. I did not get to hear the press conference today, but it's my understanding that there will be an updated epidemic order out Monday that will reference this. So that may coincide with some of the MIOSHA stuff that's going to come out. So we will kind of see what that brings, but that will consolidate that my back to normal plan and kind of speed that process up a little bit, which I'm thinking, as long as our numbers continue to go as they have been, will be something that will be appreciated by everyone. So we are getting a lot of questions, regarding the new CDC guidance related to, are we able to ask individuals if they are fully, if they are vaccinated or not? And while I cannot, I'm not going to provide legal counsel or legal advice to you. My response to that has been generally that you probably need to consult with your legal counsel on that. But as an employer, you are required to provide a safe work environment. And so what I am seeing and hearing from some of the legal counsels around and comments that we're hearing from work sites, they are being advised that they can make that ask of their employees whether or not they are vaccinated. And so, we'll be waiting to see if additional guidance on that is going to be included in the MIOSHA piece. I would expect that there is, and that it will be. That's kind of what I'm hearing along those lines. So other than that, everything else pretty much continues as is, and I think that's everything that I had intended to share today or provide an update on for today. So I don't know, Jordan, do you have anything else?
I do not. I'll send my data to Brett and he can send it out to the group.
Okay, Brett, anything that you'd like to share?
Nothing for me.
Okay, then I guess are there any questions out there from anyone? We'll try to answer those. All right, if there are no questions, then today will be kind of a short update call. Again, if you have, if you have questions after today or something, you think of something, go ahead and, email that to me, let me know. Again, assuming, there's no big changes in the epidemic order. If there is going to be a new one out on Monday, we'll send something out, or if the MIOSHA guidance comes out, we can send something out on that. We are not scheduled to meet next week. We did decide to move these meetings to every other week. So it'll be 2 weeks when we talk on that. And looks like there's a question. Any update on bar curfews? Not in the new information that was released today, but that may be included in the new epidemic. If there's a new epidemic order that comes out next week, it may be included in there.
That is part of the 60% step is lifting that curfew for the My Back to Normal plan.
Yep.
So,
and I think are we at 58.6 or 56.8?
56.8.
Okay. All right, guys, if there's nothing else, that's, like I said, that's all I have. If you have questions, go ahead and email them out to us and we'll get an answer back to you. For some reason, we need to pull the group back together. We'll do that sooner to share information with you. Otherwise, like I said, we won't have a call next week. So everyone have a good Memorial Day weekend. Hope you enjoy yourself, take some rest, and stay safe. And other than that, I think that's all we have for today, guys. Thank you.